Good morning, beautiful souls. It's Dr. Danny. Today, I am on my way to get my hormone replacement therapy. So I thought I'd talk about that today. But I wanted to show you one of my Jeep ducks before we got started. This guy. This is a big one. I think I've shown you 2 or 3 of these guys already. So here's one. All right, let's go. So let's talk about hormone replacement therapy. So if you are female between the ages of like 35 and 55, chances are you've had some sort of hormonal episode of some sort where you feel emotional, almost like you're going back to your teenage years. And for years, I mean, they didn't teach us this stuff in medical school. For years, I'd have women coming to my office between the ages of like 35 and 45, and they would say, Dr. Edmond, I must be going into menopause. And I'm like, oh my gosh, you're too young for that. No way. There's no way. So about, maybe 4 years ago now, when I was 47, 46, I started going through this really emotional time. I mean, it was really, really bad. Where, well, number one, I was working a lot. I was working, like 60 hours a week and just burning the candle at both ends. And it was just too much. It was a lot. And then my dog died. This was 21. So, I appreciate all the sympathy. But I've done my grieving for her. But that incident actually put me into what's called adrenal fatigue. My thyroid started going out of whack. And I did everything I could nutritionally. Like I started taking vitamins. I just started watching my diet, but it still didn't work. I still didn't quite feel good, and I was having a lot of trouble sleeping. And we, as a practice, decided to start offering the service BioT, which is a bioidentical hormone replacement for men and women. And what they mostly specialize in is testosterone replacement. And I thought, oh my gosh, this is so dumb. This is not something that people need, because I like to do natural things. I'm like, I'm gonna go through menopause without without any help. That was my whole deal. And so I went to the training for the supplements, because what BioT does is they do these pellets. For women, they're really small. They place them subdermally. So they got to numb your skin and then put it under your skin. And so we learned how to do that. But during the 2 days of seminars, I learned a lot about testosterone metabolism, testosterone therapy. And then I got my labs checked, and then I was like, oh, okay, well, maybe I need to look into this. And so I went ahead and I tried it. And it was one of the best things I have ever done for myself. I'm not trying to sell it to anybody, but that's where I'm on my way to go today, is to get my female testosterone supplement. And I've been doing it for about 4 years now, and it has changed everything for me. It really is amazing. What happens when you're 35 years old as a woman is your testosterone levels, they're here, and then all of a sudden they start to drop very slowly, very insidiously, to the point where when you're like early 40s, you think you're already in menopause, because just the way you feel. There's at least for me, there was a constant sense of anxiety. There was a lack of sleep. It was all these like self-conscious things that were coming back, like from my teenage years, that I thought I had like figured out and stopped worrying about. So I did it, and then everything changed. Like my emotional level like evened out. My ability to sleep evened out. I just felt more excited about life. And it's really subtle. It doesn't like come on the second you get it. It takes about 2 to 6 weeks for it to get to its base levels, and then after about 12 weeks, it starts to decline. So that's where I'm going today to do that. And if you wanted to do something like that, you want to talk to somebody that provides those pellets, some sort of bioidentical pellet. You want to ask them to do lab work on you, so they'll check all your hormone levels, estrogen, testosterone, FSH. They'll also check your thyroid, cholesterol, electrolytes, complete blood count. They'll look at all of that before you get it. And if you're basically healthy but your levels are low, they'll calculate a dose that's good for you. Now, whenever you do anything like this, like hormone replacement therapy, or you start any new sort of therapy, even if it's a natural therapy, you want to make sure you assess the side effects, the cost, all of those things. So for BioTE, most insurance companies will not cover it, even though it makes females feel so much better. It's so bizarre. So I'm using my HSA account for that. I have some money saved up in that, so that's how I pay for my hormones. Now, in terms of hormone replacement in general, if you are approaching the age of menopause, which is around 50, 51, and you notice yourself having hot flashes, or you notice yourself having difficulty sleeping, decreased libido, check the testosterone first before you do the estrogen. Because the estrogen and the progesterone come with actual, like, potential side effects, potential adverse reactions. Now, with testosterone, it's relatively safe. I haven't had a lot of women who've had a lot of bad side effects from it. And those that don't like it, you can just simply stop taking it and you're fine. Now, with estrogen and progesterone, which are the other two hormones you can get, there are some issues. So for the hot flashes where you're just sweaty and then you're cold and then you're sweaty and then you're cold, you want to get your lab work checked to make sure it isn't anything else. But if it's your hormones, you can supplement with estrogen, but you want to use the smallest possible dose for the minimum amount of time. To help with estrogen depletion, the best thing I have found is actually diet and exercise and staying away from alcohol. Okay, so those are the big things for estrogen. But if you're going to take estrogen, guys, listen, if you're going to take estrogen, you also have to take progesterone. Okay, estrogen in itself is relatively safe if you don't have any other medical problems, but progesterone is the one you have to watch. Progesterone is the hormone of pregnancy, and if you have a uterus and you want estrogen replacement therapy, you're also going to have to take a progesterone. And progesterone increases your risk of breast cancer a little bit. So you want to be really careful if you're taking progesterones. For me personally, I can't take estrogen because when I do that, I will get what's called migraines with aura. So I'll get this weird vasospasm, and then I have what's called a scotoma in my eye, and I can't see out of one field of my vision for a little while. So it puts me at risk for strokes and things like that. So I stay away from the supplemental estrogen. But what's nice about the testosterone, guys, and here's the cool biochemical trick with it. Because it's bioidentical and it's not made from horse urine, which is what a lot of the pharmaceutical companies use when they're giving you supplemental estrogen or testosterone. It is not made from horse urine. It's bioidentical. So it's just like what we normally make. And for women, the testosterone that we make usually comes from our adrenal glands and our ovaries. For men, it's from their adrenal gland and their testicles. So when you have excess testosterone, which is what you're going to have when a female's supplementing with testosterone, that automatically aromatizes, which is a biochemical process, into your own natural estrogen. So it's pretty cool. So my hot flashes actually get a little bit better when I take the testosterone. So at any rate, that is what I'm doing. And I wanted to give you guys a quick little chat about hormone replacement therapy. Now, there's people that should not take hormone replacement therapy. Those of you that have had breast cancer, that are receptor positive to estrogen or progesterone, you absolutely should not take estrogen or progesterone for your hormone replacement therapy, because what it does is it makes your cancer grow. So you don't want to take those hormones. But there is a possibility for you to supplement with testosterone if you take another drug that will help inhibit aromatization of the testosterone. I hope that makes sense. Now, if you are taking thinking about taking testosterone because you want to feel better, you want to sleep better, you want your menopausal symptoms to get better, you want your libido to get better, which is all the reasons why I take it. You also want to know what the side effects are. So the side effects of taking supplemental testosterone can be acne. It can be extra sort of hair growth, like the male pattern hair growth. And sometimes women will also have a little bit of hair thinning, like male pattern balding. So you want to make sure that you actually have the correct dose. And there are also additional natural supplements that you can take with your testosterone therapy that will help with excess testosterone if you're taking it. One of those is called DIM, and I think it stands for diindolyl methyl sulfate. And that basically helps with that aromatization process that we talked about. So I take DIM, I take extra vitamin B because that's good for energy and it's good for your immune system. I also, when it's not summertime or if I can't get sunlight, I also take vitamin D. It's a super supplement that it is the precursor for all of your natural hormones, vitamin D is, and also for your immune function. So all of the proteins and hormones that you make in your body, the baseline substance is essentially vitamin D. So you need to have a good vitamin D level. If you don't, your immune system will suffer and you can get sick. I've been keeping my vitamin D levels at a normal or high rate for about 5 to 10 years, and I haven't been sick. I just, COVID passed me by, the flu passes me by. I don't get sick. So if you feel like you are interested in this, email me, let me know. I can help you ask the questions to your healthcare provider so that you know what it is that you're thinking about when you go in to see your doctor. You can email me, and if you have any questions about hormone replacement therapy, whether it be testosterone, estrogen, progesterone. Now, I forgot to tell you this, guys. If you have had a hysterectomy and you want to use hormone replacement, it is safer for you to use estrogen only. So if you are somebody that doesn't have any contraindications to using estrogen, then you are an excellent candidate for estrogen only. You don't have to take the progesterone, and you don't have to worry about the risk of breast cancer if you don't already have it. Let's see, what else? Let me just talk to you real quick about some other contraindications for hormone replacement therapy, especially the estrogen and progesterone, because it's not something that you can just fix, right? So if you've ever had a blood clot, like your blood is thick, okay, so maybe you've had a stroke, or maybe you've had a pulmonary embolus, or maybe you've had a DVT, you are not somebody who can take estrogen. It is contraindicated for you. Anyone that's had breast cancer, like I've said, and anyone that has had migraines with auras, because it puts you at risk for stroke. So those are the 3 things you want to really watch out for if you're considering hormone replacement therapy. Otherwise, guys, menopause is kind of a transient situation, but it can last for years. And a lot of times when you're, late 40s, early 50s, you still have to perform at a very high level to function in society. You still have young kids, you still have your high-powered job, and then you've got your parents that are aging and you need to take care of them. So people need you in a lot of different places. And so if you're not in a position where you can start withdrawing yourself from those high energy activities that you involved yourself in your 30s and 40s, then you really need to pay attention to your sleep. Make that a number 1 priority. Get a brand new bed, get brand new pillows, get brand new sheets, make sure that you're wearing comfortable clothing when you go to bed. You can use supplements for that. We've talked about sleep cycles before. Also diet. If you can get your diet under control and eat well, there's a menopause diet you can look up and eat that. So cool. Well, I'm here. So don't worry, I won't look totally different the next time you guys see me on camera. I will still look normal. But this is a way I can keep my high functioning life going, and it keeps me pleasant and keeps me from getting too emotional and helps me with my sleep. So I will see you guys later. Quick update, the Mars class, if you all are not in that for astrology, please sign up for that. We are filling it up, and it is going to be amazing. There's already modules available for you guys. Let's see, what else? I'm going live probably twice a week now. I really like the lives. It's actually less work on the back end because I don't have to, process a video and then upload it and all that good stuff. It just goes right to where I want it. So we'll probably be doing that a couple times a week. Yeah, that's all I have for you. All right, you guys. I hope you have a fantastic day. Namaste.